University of Leeds, Division of Biomedical Imaging School of Medicine. Now that you're going on your first placement, here is a guide on how to do a chest X-ray. With feet slightly apart for stability, the patient stands facing the image receptor with their chest against the detector. The chin is extended and placed on top of the image receptor. This is to make sure the chin does not obscure the apices of the lungs and any anatomy. The median sagittal plane is adjusted at the right angles to the middle of the image receptor. The dorsal aspect of the hands are placed behind and below the hips with the elbows brought forward and the shoulders rotated anteriorly and pressed downwards in contact with the image receptor. Rotating the shoulders anteriorly is very important as it moves the scapular body, allowing better visualization of the lungs. If the patient has reduced mobility, the alternative is to allow the arms to encircle the image receptor. Don't forget to put a correct anatomical marker which should show up on the right side when you take your image. The horizontal central beam is directed at the right angles to the image receptor at the level of the 7th thoracic vertebra. The spinous process of T7 is found using the inferior angle of the scapula. This will ensure the whole area of interest is included. Exposure is made in full normal arrested inspiration, so instruct the patient to take a deep breath in and then hold it, which will ensure that the lungs are fully inflated. After the exposure, don't forget to instruct the patient to start breathing normally again. Make sure there is a focus receptor distance of 180 centimeters to minimize magnification. Make sure the area of interest is all on before letting the patient go. This is a labeled chest X-ray. You don't have to mention all the anatomy on the image, but it is good practice to have knowledge of what it is you're looking at, and if you notice any abnormalities, state those first. Okay, now you can have a go at the quiz.